as an introverted visionary holistic health practitioner, it could feel really exhausting to be constantly doing things to be marketing your practice. So, one great avenue of attracting patients, even 3 to 5 new patients a week without having to be constantly marketing, is by bringing in a flow of patients through doctor referrals. MDs have thousands of patients in their practices, and many would be willing to refer if they knew about you and how you could help them. Imagine if you had 3 providers sending you 1 or 2 referrals a week. What would that do for your practice? Like, you don't really need a bunch of people. You just need a handful of people who are your biggest champions. But, how do you go about this in a way where it's fruitful? I remember hearing about a chiropractic practice management company recommending to their clients to mainly be writing like this big list of MDs in the area. It was like write a list of 100 and then reach out to all of them. It's a numbers game. And I thought, oh my gosh, just hearing about it makes me feel exhausted, especially as an introvert. So can you relate? So you don't have to be going at it in that kind of a route if you are able to be more effective with it. And from my many years of experience with practicing in the conventional medical world in different settings, in the hospital setting, in the outpatient setting, at the FDA and at Merck, I've seen what actually gets doctors to refer and what doesn't, and can give you the shortcuts to that. And so this is Chen Yen, your 6 and 7 figure practice makeover mentor at Introverted Visionary. And where we help visionary holistic health practitioners grow their practices to be fulfilling as the introverted way. Here are some of the things that I've been hearing from you about where you're at in the process of attracting doctor referrals. So some of you are saying that you haven't tried it yet. And then some of you have mentioned that you have tried to give out business cards or stop by and give them brochures or flyers. Either they haven't told you they would do anything with it, or they have said to you that they would put it like at the front desk. Right? And some of you are saying that you've had a good conversation, but they're not referring. So, what do you do about this? The reason why those different methods that I just shared with you may not be working very well is because many times we might be expecting too much from one conversation with a doctor. It's almost like expecting to get proposed to on your first date. And so, is that realistic? It's not realistic. So, how can you speed up getting referrals from providers? What do you need to consider to ensure that you're successful with this? So, first, you need to reach out to providers who are more likely going to refer people to you. So, not everyone is going to refer. Unfortunately, I wish this were the case, that more medical doctors were just open to referring, but for different reasons, whether it's because they are more closed-minded to other options aside from conventional medicine, just simply because they're not aware, or or they are aware but they're still skeptical. There are many reasons why they may not be interested in referring. One thing I often hear from practitioners, holistic practitioners, is like being concerned that they won't refer, and that's true. There are going to be some that won't refer, but then you don't need everybody referring. You just need people who are your biggest champions. You just need a handful of people who are your biggest champion. Best thing is to first be reaching out to providers who are more likely going to refer. So who might they be? So they might either be people for whom you have mutual patients and you've gotten good results for your patient, and then you have a mutual patient. It could also be other kinds of providers who are more likely to refer. You could be getting referrals from other conventional medical practitioners, DOs, PTs, nurse practitioners, nurses, and from holistic practitioners too. I sometimes hear from holistic health practitioners that, well, as soon as doctors hear that I don't accept insurance, then that's the end of the conversation. Or doctors are part of a big hospital system, and they're not to refer outside the system. Like, they have to refer within the system. And so let's talk about those things. So what do you do when a doctor says to you that, well, you don't accept insurance, so I can't refer? Is this. So you can let them know that It is not, because what is the issue with that situation? Well, it's almost like that doctor is making decisions about a patient's care based on what they think a patient can afford or not afford. And that is actually not really kosher. And so it's up to us to educate the provider about how that isn't really kosher. How do you do that, though? There are ways of doing that in a way that doesn't make them feel bad, or you're pointing something out that they shouldn't be doing, right? So there's a way to do it in a way that feels good for them too. For example, one simple thing that you could say is, I can totally understand that you're looking after your patient to see if it would be covered by insurance. And at the same time, it's up to us as providers to let them know their options, and then they can make their own decision about what they would like to do. And then you could share a little story. For example, one of our clients actually said that she's a naturopathic doctor, and she has an all cash based practice. She was going to be moving her practice an hour away from her previous location. And she told a patient of hers, a Medicaid patient, she told a Medicaid patient of hers, let me give you a referral to another doctor who's closer to you. And guess what this patient said? No, I'm going to save up my money to go see you and take a train to see you. And that left such a strong impression on my client. It just made her realize that, people will pay for and prioritize what they find to be important. And it's really not up to us to judge whether or not they can pay for it or not, because that's actually being unfair to them by saying, oh, I'm not going to tell you about these services. I'm not going to tell you about this doctor because I don't think you can pay for it. Right. So what you can't do is share what I just shared with you about, how to frame it to that doctor. And then another thing is that you could even share a story like that. You could say, for example, there's a naturopathic doctor who had a patient who was on Medicaid. You could tell the story that I just shared with you. And it's a great illustration of how it's not up to us as providers to decide who we do or don't share as options to our patients just because we think they can't afford it. And so now, some of you have brought up to me that, but medical doctors won't refer because they work as part of a hospital system and they are required to refer within the system. And so, yes, that's true that you might see that, especially if you live in an area where you feel like it's just a lot of places are bought up by institutions, then you might really feel that being the case. So here's what I would say about this. Number one, there are still medical doctors and other kinds of conventional medical practitioners and holistic health practitioners in your area who are not a part of those institutions and who will refer. And remember, you don't need a whole ton of them referring. You just need a handful of people who are your biggest champions. So first thing is that. Second thing is that even if a doctor is supposedly required to refer within their system, if they actually knew about you and what sets you apart from other providers within the system, and they recognize that their patient needs a certain specialty or of expertise, it's still possible for them to refer. Doctors are in it to help their patients at the core of it. They still would like their patients to get the best outcomes. And so it's still possible. I mean, just because whether it's like that institution typically refers to acupuncturists within that system, whether it is that institution typically refers to whether it is that institution typically refers to dietitian within that system, if you are able to communicate to providers in an effective way what sets you apart, so that in certain cases it makes sense to refer to you, you could still be getting referrals from providers. So those are two hot tips for you. Another hot tip related to like who to actually reach out to is, if you have mainly a cash-based practice, you may want to consider reaching out to providers who have more concierge-based practices or who have cash-based practices, as their patients are also used to paying cash for services. At the same time, Just because you have a cash-based practice doesn't mean that a patient of theirs who would prefer to use insurance won't pay cash for your services either. So it's just about educating the provider in such a way that they feel comfortable in telling their patient about you when they feel like it would be a good situation to have their patients come see you. And so what we have just talked about so far is the first step, which is about reaching out to providers who are more likely to refer to you. Then the second step is to get your foot in the door. So there are different ways of getting your foot in the door. There are also ways to speed up getting your foot in the door. So there are different ways that we help our clients with getting their foot in the door in front of providers. One way that has worked really well for our clients who are open to this is something that can speed up getting provider referrals. What is it? It's to educate the providers about a particular topic that would be interesting and helpful for them. Why? Because if a provider is limited to just getting to know you more, there are many people who are trying to get their attention, whether it's drug reps, whether it's other providers, vendors, salespeople, like all kinds of people all day long, all the time, every day, like different people trying to get doctors' attention. And so if you just have a good connection, that may get you only so far. But if you're able to educate them, see, many times they may not be referring to you because they either don't know about you or they don't know the extent, the scope that you can really help their patients. But if you can educate them more about that, then they're much more likely to refer. So I look at it like this. It's like creating one signature talk that you can use over and over again in front of different providers. And you could educate them either one-on-one, via Zoom, or in person, in a clinic setting, or in a larger setting. For example, one of our clients spoke in front of 70 providers and ended up getting 10 patients out of that. So there's a range of what you could do with this. So this is one avenue that can speed up getting referrals from providers. And you don't need to come up with a lot of different topics or talks, just one. You just need to come up with one good signature talk that educates and also inspires referrals. And also, it's a different thing to just educate. It's a totally different skill set to just educate versus educate and inspire provider referrals as well. So I mentioned step 2 is getting your foot in the door. And what I just talked about ties into that, because you could get around the gatekeepers this way, by the way. I get asked, like, how do I get past the gatekeepers? Well, this is a way to get around them. And when we work with our clients, we help them with how exactly to get around the gatekeepers in this way and have that opportunity to talk to providers. And so step 3 is to develop the relationship further, which you can develop the relationship further, speeding it up by educating them through one signature talk, one good angle of a topic that can help them understand the scope of what you could really help their patients with. And then there are other ways that are important to also further develop that relationship, like what to have in place that will really support you getting your first referrals. And then finally, having a system in place that helps support getting ongoing referrals without you feeling like you're bugging them. So those are the 4 steps that are really key to speed up getting referrals from providers. And many holistic health practitioners either don't end up going this avenue, or if they consider it, they may not get to the point where they start getting their first referrals and more referrals and really make it a point to have this be a main avenue of attracting patients. And one great thing about attracting patients from provider referrals is that the patients who come from provider referrals are more likely to start care and stick with it too. It's just very different from people hearing about you from an ad or online or seeing something like that, because they are told by their doctors to come see you. They just already have a different level of trust in you than any other way of attracting patients. And so, but I see that many holistic practitioners don't end up going this avenue. And yet the ones who do and get this to pop end up having this as a great avenue without having to be constantly marketing. Or they have this as an addition to other avenues. And so they end up having a really nice flow of patients, whether it's for themselves or for their associates in their practice. So this is something that I'm super excited to be helping our new cohort of clients with coming up soon. And so we have a couple of different ways we're helping our clients with this, whether it is that you have no interest in going the route of speeding up getting provider referrals by getting a signature talk in place, or you do have an interest in that. So we have two different avenues of how we could help you with getting doctor referrals coming in the door and a nice flow of patients, a repeatable process in place to be attracting new patients from doctor referrals. So I'm super excited to be helping you in a makeover mentorship in this way, whether it's the consistent patients makeover mentorship for introverts or our 6-figure speaking makeover mentorship for introverts. Go to introvertedvisionary.com, book a free chat with us, and more than happy to see how we can help you further with this and accelerate growth in your practice to one that you're proud of and also makes good money. And if you're already really proud of your practice and you're doing well in it, then really helping you take it to the next level. Being able to not have to be constantly posting on social media or spending money on ads, but rather getting known as a go-to practitioner in your area by doctors and putting you in a different limelight that way. Imagine getting referrals. It's one of the few ways you could be getting referrals even 3 months from now, 6 months from now, or a year from now, which is really exciting. So with that, look forward to helping you with this. And if you haven't yet hopped on my free masterclass on how to bring 3 to 5 new patients a week from doctor referrals, you're welcome to click on a link and then register for it now. And I'm more than happy to help you further with this also if you would love to have more free training in the meantime as well. So look forward to seeing you soon and helping you further with taking your practice to the next level.